mission is that JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is enhancing the health and safety of Jefferson County.
Thank you. So, first item is approval of the proposed agenda. Everyone got a copy of
I
that?
make a motion to approve the agenda unless someone like to amend it.
I have a motion. Can I have a second, please?
I'll make a second.
Okay, discussion?
Mr. Chairman, I'd like to move something in the order of new business. You have number one, I'd like to be able to make my statement or speech right after that and before the act on recommendation to adopt.
May I inquire as to why you'd like to move it?
Some things that I'm going to be speaking about will pertain to that. So it would make sense to be in that order.
But I don't think you can discuss it until we get there to discuss it. Correct?
Well, I won't be discussing it, but there will be things that I'm saying that will, that I believe the board would like to have that information.
Mr. Deal, I think we talked about splitting up your new business and putting number 2 after the closed session.
Yeah, that was a change I wanted to propose. So,
You want to make an amendment?
if we move new business point 2 to after closed session, and the purpose for doing that is to have discussion or answer questions in closed session so that we can act on it when we come back to open session. So that's one potential change. And so what are you asking for, Ms. Davis?
I think that would help take care of it, but I believe that anything that we're going to discuss about it needs to be on public record in front of the public,
Any vote will be an open session.
the vote, but not the discussion and the questions and,
So why would, let me,
needs to be in front of the public.
There'll be discussion
can
before the vote.
Ms. Davis, the reason I made the recommendation is because I'm sure that the board will have questions of the council that are attorney-client privileged communications and not subject to the sunshine law that should not be had in open session.
I'm sorry, Tim. Yeah.
that answered my question that I was going to ask is why, where are we moving it? That answered the question. So I'm gonna retract my original motion for the approval.
Okay, so I have a motion to move new business item number 2 to after closed session, once we get back into open session. So anything else? Okay, so that's the motion.
second
Have a
that
second on that. You have a second, Tim?
Yes.
Okay, I'm sorry.
Thank you.
Okay, so any other discussion? Okay, hearing none, all in favor of approving the amended agenda, please say aye.
Aye.
Anyone opposed? Okay, so that's approved and the agenda is approved as amended.
I make a motion to approve the November 19, 2021 special meeting minutes.
Second. Okay, motion and second to approve those meeting minutes. All board members were here for that meeting. Any discussion on that? Hearing none, all in favor of approving the November 19th special meeting minutes, please say aye.
Aye.
Anyone opposed? Okay, those are adopted.
Make a motion to approve the November 30th, 2021 meeting minutes.
Second.
Okay, so motion and second to approve the November 30th minutes. Dr. Henry wasn't here, everyone else was. Any discussion on that? Okay, hearing none, all in favor who were present of approving those November 30th minutes, please say aye.
Aye.
Anyone opposed? Okay, so those are approved. Next, we have approval of the November 2021 expenditures. Amount I have for those is $185,560.96.
I'll make a motion to approve.
Second.
Okay, so motion and second to approve those expenditures. Any discussion?
Mr. Chairman,
Ms. Mann?
noticing on 11/10/21, Wheeland Insurance for the mobile units. Kelly, how many mobile units do we have?
We have 3 larger units and 3 smaller units.
And that was for $10,120. That it is on record, that is Mr. Senator Wheeland's insurance company, and I'm just wondering if that might be a conflict of interest, possibly. Just throwing it out there. Also, on 11/18, Sandberg and Phoenix Legal Services, $70,125 for the month of November. Understand that we did need to defend ourselves, and I get that. Another $2,000 from Sandberg and Phoenix as well. I'm very concerned that anything we do to join ourselves in with anything else is going to cost a lot. This is a good example of what it can cost us. And so I just want the board to consider that again, how important it is to be careful with our county's money, our health department's money.
Mr. Chair, may I have a comment, please?
You have a comment?
May I have a comment
Yeah.
on that? And following up to the expenses on our legal bills, one of the issues that has been an ongoing expense has been the sunshine requests, as well as lawsuits that have been brought in opposition to the health department's best practice ways and recommendations. And so in just stating that and the need to defend ourselves might not necessarily have been so great if we didn't have if we had all of our board members supporting our agency policies and best practices. So I do feel that, yes, 14,000 is a lot to spend on a lawsuit, but those are unnecessary expenses when we have an extremely supportive board. Thank you.
Mr. Chairman. In rebuttal to that, though, Kelly, I do come representing people
Call the
that,
question.
want me to say certain things, and so I do. And not everybody believes like Kelly Vollmer does, and Dennis Steele and Tim Pig.
Okay,
And so, I've been voted in, and I bring this to the table.
that's fine.
And,
I was voted in,
by you
James
guys,
voted in, Amber's voted,
hiring-
we were all voted in. so-
right, we were all voted in, and, for you guys fighting me,
That's
or
fine.
You were
hiring
fighting all of
the attorney
Ms.
to
Davis, you're out of the way.
try to censure me, all those silly kind of things,
You're out of
You
order,
should
Ms.
over
Davis.
nothing.
You did it
You're out of
yourself.
It cost you money, so.
You're out of order. All
Um,
right,
I'm
thank
sorry.
you. So we have a motion and second to approve the November expenditures. All in favor, please say aye.
Aye.
Anyone opposed? Okay, those are approved.
I register as opposed for the secretary.
I would
I
appreciate
register as-
if you
I-
vote
I
when I
understand.
ask you to vote, and also to wear your mask properly. It's it's ridiculous. It really is.
It's childish.
You're going to get a copy from my doctor, okay? I have a severe asthmatic condition.
Okay,
You'll be lucky if
so
I
the
make it
next
through this
item
meeting,
is
honestly.
approval of the November 2021 electronic payments. Those are in the amount I have of $476,779.76.
So moved.
Second,
Okay, a motion and a second to approve those payments.
The electronic payments.
Yes, ma'am.
Okay, yes. Have you asked for discussion?
Do you have a
Yes,
discussion?
sir.
Okay.
Mr. Chairman. I just was noting that, we're paying about $253,000 in salaries. And our United Healthcare is about a fourth of that, same amount. So a good $60,000 is being spent on just healthcare alone. The payroll taxes for our employees is running about 90,000. So I think in the future, it'd be a good idea to look into possibly seeing what we can do to get a better price on that,
On what?
on the United Healthcare, get a different insurance.
Okay.
Possibly.
We look at
It
that.
just sounds like it's high.
We look at it every year.
And I could be wrong, but, I'm just saying, it seems like it's a bit high.
Mr. Chairman, the insurance prices for covering employees nowadays are ridiculous, and they've gone up every year, so. For approximately 100 employees, I don't see that cost as, crazy off the wall, but again, it should still be put out.
And I know if you're this, make due diligence about saving the money.
Okay, so the motion second to approve those electronic payments. All in favor, please say aye.
Aye.
No opposed to those. Vote, Ms. Davis?
It was an aye, because I didn't say anything.
Okay, thank you.
Point of order. Doesn't she have to vote
You
one
have to
way or another?
vocalize
She
your
can't-
vote, Ms. Davis.
Thank you.
Thank you.
Okay, final approval is pre-approval of the January 2022 electronic payments. Estimated amount for those is $584,367.25.
So moved.
Second.
That's my man.
Mr. Chairman?
Yes.
I don't have it in front of me handy, but what are we looking at for legal fees that month?
Legal fees.
For the month of January 2022? Is it proposed?
These are electronic payments.
What kind of payments? Oh, okay, gotcha. So no, it wouldn't be any.
Okay, so I'll call a question and vote. All in favor of approving those electronic payments, please say aye.
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 Pass. Okay, so next is our director's report.
There's a couple things that I'm going to be covering underneath the director's report. I will give a brief overview of where we stand with our current cases, as well as I have asked Gina Vidicek, who is our supervisor for the public health preparedness group, who oversees our COVID response, as well as our epidemiologists and our general communicable disease nurses, to come and help give a presentation about our expectations of the 10 essential services of all public health departments, which include communicable disease control, and just an overview of what is involved in communicable disease control, so that you have a better idea of the types of things that we're asked to do underneath several over 100 different diseases and conditions, which are required to be reported and acted upon within the state of Missouri. One thing I will just ask politely is, Mr. Chair, can you please ask Ms. Davis to tighten her scarf so that she is truly wearing a mask in accordance with our policy for the agency.
Dear God, you guys, give me a break. I
Ms.
can
Davis,
barely
you are a
breathe.
board member representing our
If I
agency, and we
tighten
do
this, I'm not
have
gonna
rules
just get
within
in
our
here.
board.
This
I
is
just
dumb.
simply ask that you are following
My
them,
nose
just
is
like
behind
everyone
the
else.
mask, that's what you need.
We have to schedule them to follow the health during office for the body.
I have asthmatic bronchitis, I'll start coughing, I won't be able,
Ms. Davis, you've managed to make it through a couple of hour board meeting with wearing a proper mask and have not had one of your episodes. And so
Oh,
I
that doesn't
apologize
mean
if you are having issues at this moment in time, but do request that you wear a proper mask as we continue our meeting. So as we move on to the director's report, Brianna, can you please bring up the PowerPoint first? Sure. So just giving you a little information about where we stand. We continue to see increases within the eastern region. We are not necessarily seeing the same types of increases in our cases as the Northwest and Kansas City areas. They have seen some tremendous growth in their caseloads over the last couple of weeks. We have necessarily started to see some growth within our area and anticipate as we move into the holidays with having both Christmas and New Year's 1 week apart, we definitely are going to be seeing some higher case rates after people are home and gathered over the holidays. One of the things we currently are looking at is this is at the end of last week. It is from the St. Louis coalitions, and they were looking at our percent positivity rates for testing. Jefferson County as well as Franklin County are showing the highest rates for right now in our region. And then if you want to go to the next one. Again, looking at our new cases, bed occupancy, and in new admissions to the St. Louis region's hospital systems, we're looking at the past 12 months. And as you can see, again, our case rates have been increasing. We're starting to see similar trends to what we saw last year in terms of reports of new cases. Our ICU beds are continuing to increase even higher than our inpatient beds as well in terms of our occupancy. And then our new admissions, again, are on the rise. So one of the things that I wanted to point out, the state has started designating county hotspots. And as they've looked at these, they have looked mostly at overall county rates, but have started to look into smaller areas, so zip code analysis. And one of the things that they've consistently found on the right side is the St. Louis metropolitan area. And up along the High Ridge, Arnold, House Springs area has consistently shown on the hotspot areas for Jefferson County. So even across the state, the majority of cases right now are being seen Kansas City, Northwest, and then now we're starting to see just along the Highway 70 corridor. And again, High Ridge, House Springs, Arnold continue to be in those hotspot areas for high case rates. If you go down, one of the things that's a little harder to see on this map, I apologize, they changed the colors this week on me, but it is looking at the percent remaining unvaccinated. So as we look at our adult population, one of the things that you'll notice is, Brianna, if you can kind of point to Region C over in that area. So those lighter colors are areas that don't necessarily have a gap. So what they're saying is of those who are eligible for the vaccine, the majority have received the vaccine. So you don't have a significant or a large gap. Where you see the dark colors, which is the majority of Jefferson County, you are seeing that's an area where we have larger vaccination gaps, meaning that of those who are able to get the vaccine, there are a lot who still have not been vaccinated. What we're seeing is, again, it's corresponding to those areas where we're seeing hotspot issues and continued increases in case rates. Next slide. This was just pulled from the state COVID dashboard before we came in today. So looking at the past 7 days, we are looking at 733 new cases, which comes out to 326 per 100,000. So again, that continues to keep Jefferson County in the red status. Our case positivity rate went up actually from even what we were looking at last week. Week 49, we were looking at a 14.5% positivity rate. As of today, the state is reporting 16.2%. We have our positivity rate is increasing. We have seen a slight decrease in our cases. But what's encouraging is we've had 5,000 tests in the last 7 days. So people are getting tested, but we're just finding a larger number of individuals who are testing positive. And then the last slide, again, just kind of double checking through these numbers. I apologize, we did not have our week 50 summary ready yet. We're pulling in a lot of data at this point in time. And now that we're combining both our influenza and COVID reports into a respiratory report, it's taken just a little bit longer to get all of the analysis done. So just wanted to kind of give you an update. Again, as you can tell from the charts, we're starting to see back in again those increases like we saw. If you go there, looking in our October to December region, again, we're starting to see some of those increases again. We have not seen the Omicron variant in our area just yet. They have had the sewer shed systems have detected it in Kansas City and one other county. I just lost it. But in one of the other Livingston, Buchanan, yeah, yes. And one of the things that you'll notice is those are both on the western side of the state, and those are where we're seeing the cases increase significantly and the higher pressure on hospital systems. So that's that. And what I will do at this point in time is I'd like to go ahead and introduce Gina Vidicek. And Gina is going to share with you some information about how communicable disease plays into our larger role as public health. And then we'll follow up with a little more information.
Can I ask a quick question?
Yes, ma'am.
Is it difficult to get tests? I've been seeing in the media that people are saying it's difficult to get COVID tests. Are we seeing that in Jefferson County?
So the home tests, I believe people are having trouble accessing or going and buying them at like Walmart. Testing is available. So testing, we have free testing at the health department. We have, you can get tests done at Walgreens, Walmart, so any of your pharmacies, and through urgent care's private providers. So the testing is available. It just is, I think people are comfortable with the home test, and that's what they're looking for.
But it is available free at the health department.
It is available free here at the health department. Correct.
So my name is Gina Vidicek. I'm the public health preparedness planner, and I supervise our communicable disease team. And I have the opportunity to talk to everybody today about what public health's role is in preventing communicable disease. As public health, our role is to promote and protect the health of people and the communities where we live. Doctors treat individual patients who are sick, and it's our job to try to prevent people from becoming sick in the first place. As public health, we've been doing this since 1878, and that's when the United States started putting policies in place to prevent the spread of things like cholera, smallpox, plague, yellow fever. The system has been in place for quite some time, and when it's done well, most people don't even realize what we're doing in the background. And we've been doing this protecting folks for almost 144 years now.
Gina, can you take about a step and a half this way? Thank you. And speak just a little bit louder. Thank you.
You're welcome. We're thankful that these systems work so well, but we do realize that because they work so well, we haven't done a really good job of informing the public on our piece of it. COVID shined this bright spotlight on us, but it's still not telling the full story. So that's what I'm going to try to get across today. I don't know if we've discussed in these meetings, but public health, we operate under 10 essential public health services that provide that framework for how we protect and promote our community. So those 10, assess and monitor population health status, factors that influence health and community needs and assets. We investigate, diagnose, address health problems and hazards affecting the population. Communicate effectively to inform and educate people about health, factors that influence it, and how to improve it. We strengthen, support, and mobilize communities and partnerships to improve health. We create, we champion, and we implement policies, plans, and laws that impact health. Utilize legal and regulatory actions designed to improve and protect the public's health. Assure an effective system that enables equitable access to the individual services and care needed to be healthy. We build and support a diverse and skilled public health workforce. Improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. And lastly, we build and maintain a strong organizational infrastructure for public health. All of that is why we do what we do. How we do that in communicable disease is through case management and contact tracing. We use those mitigation strategies: isolation, quarantine, social distancing, masking, good hand hygiene, and pre and post vaccination. Here in the state of Missouri and across the United States, providers and laboratories are required to report positive results to the state health department for diseases and conditions that are a mandatory report, and they're listed in 19 CSR 20-20020, 2 pages full of hundreds of different diseases and conditions. Some of those: botulism, plague, rabies, hepatitis A, measles, mumps, pertussis, polio, tuberculosis, syphilis, sexually transmitted illnesses. Those are just a very, very small portion of what we do. I think back to when we watched old westerns or old TV shows, and they depict these diseases that were once very prevalent, debilitating, fatal. My favorite is, think of Doc Holliday and Tombstone. They haven't all disappeared just because we live in this modern world. We control them by the case management and these implementations that we have in place. A really good example, measles. It was considered eradicated in 2000, meaning that it was no longer constantly present in this country. But we still have cases and outbreaks associated with travelers, and that's still our role in that, is to monitor that. Each disease that's listed on that list has its own set of rules. I'm going to talk a lot about rules. The Council of State and Territorial Epidemiologists, CSTE, the CDC, Department of Health and Senior Services, all play a role in writing the rules for what the disease and condition is and how we respond to it. Some of these rules. So COVID, we know you're infectious for 10 days, so you have a 10-day isolation. We look at exposures of 60, 15 minutes. And there's a 14-day incubation period, which equates to our 14-day quarantine. That's where those numbers come from. With measles, we know you're contagious for 4 days before rash, up to 4 days after rash. You have a 7 to 14-day incubation. And those unvaccinated are considered exposures. And that the measles virus spreads their droplets that can stay in the air for up to 2 hours after the person has left the room. So these are all those rules that are written for us that we follow. And our role, again, is to try to prevent these diseases. How we do this? What is our process? So our team, our CD team, is notified of positive cases, and we respond based on what the rule is for that disease. So every disease is going to have a different response. Our CD investigator here is a nurse. They will interview that case with this pre-designed set of questions, again, per disease. Their role is to educate on what that disease is, the need to isolate based on those rules. We collect information for anybody that may have been exposed to our positive case, and then we begin notifying all of those people of the exposure. And in that notification, again, we are educating that person on what it means to be exposed to this disease. Some diseases require quarantine, some don't. And there's also the opportunity for some for testing and for post-exposure vaccination. So that is all a role that we play in that. I have lots of examples. So hepatitis A, we're going to look at all those unvaccinated folks and encourage them to come in and start that vaccination series. We do that in-house. Sometimes we set up large pods, sometimes it's in our clinic. And depending on the size of the case, they're either reduced charge or no charge at all for that vaccine. And that's all part of this communicable disease system that we have in place. Once our CD nurse is done, our EPIs take over. So they gather all of that information that is in those interviews and those questionnaires, and they start to build reports and EPI curves. And you see those every week in our respiratory reports. They're looking at that broad picture of what is happening in the community. We want to know what we're forecasted to be, what the trend is for this disease, what it's going to look like. The EPI curve shows us those initial cases. We have this peak and it drops back down. But all those folks that were exposed are going to be these secondary cases, and you're going to have a second peak when those folks become out. And we watch that, and our goal is to get that to 0. But that's what Sarah is showing in those reports. We also watch that most everything we look for, we try to get through 2 incubation periods before we can say this case is closed. And those reports show us where we're at. We sometimes get through one and you have another case pop up and it's this little blimp on the line and you start it all back over. Sorry. In addition to all of our positive cases, we also receive information on travelers. Travelers are folks that are coming into this country from countries that are having outbreaks or travel alerts associated with them. So federal agencies put these alerts out, our airports, our border checkpoints, they're monitoring these. And when someone comes in from a country, they get flagged, is a terrible word. That person gets notified, they've come in from a country. The information goes to our state EPIs and back down to us, whichever country or county they reside in or where they're visiting. And it's up to us to make contact with that person. And we go through our same kind of contact tracing. We educate them on what to watch for and the disease that we're looking at. One of the big ones is the Democratic Republic of Congo, the DRC. So in 2020 alone, we've had Ebola alerts. And anybody coming in from the DRC to the United States, we are going to be notified. And we have to contact that person within 24 hours so that they know what their risk level is and what they need to do. Ebola is my favorite one to talk about. So we have a traveler come in and we do our questionnaire. Again, everything is predetermined. Maybe they are visiting because it's their niece's first birthday. Maybe they are attending a funeral for an Ebola patient that has passed away. Or maybe they're a healthcare worker that is working in an Ebola clinic. All of these carry different risks. In our assessment, we look at what that risk looks like, and that determines how we move forward. So first birthday party, they may just be self-monitoring. They're watching for the symptoms. We let them know what to look for, but they're still going to work. They're still in the community. It's not a huge risk. That healthcare worker is most likely going to be on a home quarantine, not allowed to leave the house. Very strict rules. These are folks that very likely will have contracted Ebola. We do this very, very well. In the United States, we've had Ebola cases, but we've not had outbreaks. We are not the DRC. We've been able to put this system in place, monitor folks, keep them quarantined, and if they become symptomatic, they've not exposed anybody. All while we're doing this, there are checks and balances for this entire system. So at the local level, we follow our rules and guidelines that are set for us. And we send all of that to Eastern District Epidemiology, so for the state of Missouri. They look at our reports. They look at how we responded, how the cases are managed, and they check that against the rules. And they check to make sure that we've done everything correctly. Once they look over everything, it goes to the CDC and they do the same thing again. So there are many, many checks and balances to make sure that everybody's following the same set of guidelines. Part of the information that goes to the CDC, the role that we play in that piece, is that helps everyone learn how these diseases are moving. So as they have these vetted scientific research comes out, it may be that the rules change. We've learned something in COVID-19 is a big one. We are learning as we go. So as those rules change, public health follows suit. We are constantly watching them. We aren't going by old playbooks. We have to stay completely correct. I feel like I went there really, really fast. So put it all together, all the information. There are systems in place to identify communicable disease and conditions or the risk of, and to notify the appropriate agencies. And there are rules and guidelines established for us to work by and systems to audit and evaluate the responses. This is a nationwide system. It's not just your local health department putting all this together. We are following this nationwide organization that all the moving pieces work well together.
Thank you.
Very good, thank
Yeah,
you.
no, thank you. So the last thing that I'll just add on to Gina's presentation is, if you don't mind putting the couple up, I wanted to show you, I know a lot of people have questions about the guidance that we give and where it comes from and how we define our case, a probable case versus a confirmed case. So a couple of things that I wanted to show you is, one, there's actually a prevention and control of communicable diseases that goes through all of the different communicable diseases that are reportable to the state, that guides the schools on how they do their exclusions and kind of what the information is. So if you can go down, and I hate to make you do that, but just like.
Just tell me when it's done.
So right there, we'll stop with the first one. So they have them broken up into the selected priorities. So depending on the impact and how quickly a virus can spread. Uh-oh.
I tried to zoom and I think I broke.
We'll see.
There we
There we go.
No,
Okay.
no zoom.
So underneath at section A, it talks about our high priority diseases, where they can occur naturally. It could be an accidental exposure. It could be a result of a bioterrorism event, but things like rabies, the plague, anthrax, smallpox, things like that, they are immediately reportable. So as soon as they are found, then basically they are supposed to be reported directly to the health department. But if you keep going to the next page. When Gina was talking about the communicable diseases and all of the conditions, when we talk about our communicable disease order and what this entails for things like preventing illness from spreading, controlling the disease, doing prevention, these are all of the diseases that applies to. So we're not just talking about COVID when we talk about isolation and quarantine or prevention and treatment. We're talking about all of these diseases. So everything from measles, I'm going to pick a couple out of these, tetanus, tuberculosis, hepatitis, encephalitis, keep going down. As you see, yellow fever, we're still going through them, HIV, the Legionella, Lyme disease, mumps, measles. So all of these are the diseases that need to be reported to the health department. And then as the health department and as the health authority, communicable disease nurses, our case managers, this is what we are responsible for doing investigations on. And depending on the investigation and what comes out of that and how many people have been exposed or how many contacts there are, then all of the things we talk about in terms of education, isolation, quarantine, or any of those pieces apply to all of these diseases. So if you keep going, one of the things I wanted to give an example. So something besides COVID to talk about today. Just wanted to look at chickenpox, varicella. So again, these are geared towards the schools to give them a little information, but just wanted to show you, again, we're talking the same language we've been talking about for 3 years. You're looking at what causes it, what are the symptoms, how does it spread? So again, from person to person, touching a blister or secretions from the nose, the mouth of a person with chickenpox. You're looking at the incubation period. So when we talk about 14 days for COVID, we're talking about 10 to 21 days, usually 14 to 16 days after being exposed for chickenpox. Talks about the contagious period, how it's diagnosed, how it's treated, and how long a child should be excluded if they have been diagnosed with this. So keep going a little bit further down, talking about if there's breakthrough infections, if somebody had been vaccinated, how you can prevent and control it. Keep going. Sorry, I'm not going to make them read everything, but I just want them to be able to see that, again, a typical parent guardian letter where we're talking about symptoms, the contagious period, if you need to contact your healthcare provider, those kinds of things. Can we, oh, great, you got it all in one spot. Okay, hold on.
Oh, sorry.
So the other side of that though, so that's on the school side. On our side as a health department, then we also have a communicable disease investigation manual, which is a lot more intensive and meaty with the background, the scientific backing or whatnot. So if you'll go just through this one briefly, just kind of showing you when we say that we have to go, Gina was talking about our rules and our guidelines. All the diseases that were listed on those initial pages have one of these guides. So it's talking to you, it gives you all of the information on what you needed to be looking for. So if you stop here on this one, just a quick, so it talks about what the clinical description of the illness is. What are the lab criteria? So how do we find out and what is the process for detecting it? Our case classification. So again, you see here our probable case and how we define a probable case for chickenpox and how we define a confirmed case for chickenpox. Keep going. Another thing that it'll talk about is when we look at varicella, which is chickenpox, death, again, probable deaths, confirmed deaths, the information that is required to be reported, excuse me, to the health department. So all of those pieces. So again, it may not necessarily be the same information that is required from disease to disease. It will specifically lay it out here. Establishing the extent of the illness. And for those who are at risk of the infection, it talks to you about how to work with those individuals who have been contacts and how you can help to prevent them from getting the illness if there's a post exposure prophylaxis and who you need to notify. Again, control, I promise I won't go too much longer on this, but I just want you to see how extensive these are. So it's a 15-page guidance document talking about everything from if an individual, Gina was talking about the different exposure levels. So is this a person who is exposed in school? Is this a healthcare provider? And when do you look at our normal recommendations for getting the varicella vaccine? And are we recommending the vaccine for adults? So again, we talk about shingles and whatnot with individuals and reoccurrence. Again, if you just go down a little bit more, I'm almost to the end of this. I think we may have lost it. But again, I will spare you on that one. But, and as we go through this, I want you to be able to see that literally for the 22 pages that is right here, we have that for every disease, for measles, mumps, TB, encephalitis. And so that is the guidebook that our epidemiologists, our communicable disease nurses go to. This isn't something that we've just picked out of like thin air. This is, there are strict rules and guidelines and scientifically backed guidelines as far as how our nurses have to be able to manage these diseases. And so when we talk about things like the Cole County case and looking at things like the ability to be able to do communicable disease investigations and orders, it's extremely important to remember that these strategies and protections, as Gina said, have been in place for over 100 years. These are the same things that we were doing when we had the big influenza outbreaks. And so definitely is a piece of, it is a tool that you want your health departments to be able to have, to be able to keep control of these viruses in the background before they become big like they have to the point with COVID. It will help to keep those things under check. So just as wanted to give you guys sort of that overview of what communicable disease investigations really is, what it involves, why it's important with public health. It is one of our essential services that we provide. And again, it's one of those things that as we are able to maintain those measures, we are able to control the spread. So as we mentioned earlier, 196 cases, new cases of COVID in the last 24 hours. We had 855 cases last week. So in one day, we had 23% of the total cases from last week. So it is definitely something that you can't let your guard down. We have to keep working our way through this. We're working our way into our third year. And we have the mechanisms to be able to get these diseases under control, whether it's COVID, whether it's influenza, whether it's measles. And so we need to be using all of those strategies and all of those tools to keep our community safe. And that's fine. Yeah. Thank you.
I'd just like to say too, I think a lot of the misunderstanding regarding all these issues around COVID is, first of all, COVID is a novel virus. So something we hadn't seen before until it was identified. And so this whole process has been evolving in real time. So we have all of these guidelines, all these recommendations for things that we've dealt with for years. This was a brand new virus. Obviously, we have experience in dealing with viruses, but they can act differently. And I think that COVID's a good example. It's not surprising that we're seeing variants develop. But I think one surprise, especially now with Omicron, is the speed that we're seeing it being disseminated. So when people say recommendations have changed, guidance has changed, please remember that this was all happening with a new virus in real time. We didn't have the tools to deal with it at first that we have now. So I think that things really haven't changed. They've just evolved as this whole situation has evolved. And I hope people can understand that. So thank you. And I hope that gives people some idea of why we do what we do and how we do it. So we're going to move on to old business. And item there is approval of a final 2022 budget. We've discussed next year's budget previously, but as I understand it, there's been some changes that have come up that we need to take into account. So
I've asked Kristen, who is our comptroller, to come and just give a brief explanation of some of the changes that were made to the budget from our preliminary budget being approved. But we felt it was prudent to do the changes ahead of time so that we walk into the new year with the most up-to-date budget. And that way we won't have to do any amendments based upon these new revenue sources. So Kristen?
Yes, we have about $507,000 available to us. That we're,
Oh, sorry, you're gonna have to.
yeah, can you come stand where Gina was standing?
speak up, please, too.
Speak up.
Yes, you have to use your own.
Okay, so
Am I good, please?
start talking and I'll tell you.
All right, so we have about $507,000 more available to us in revenues than we did prior. It was just about 3 funding sources that gave us a little bit more or made more available to us than we anticipated. So that's what makes that the 6.2% difference. But that was substantial enough to bring it back to you guys. Also, the non-operating budget is included in this budget proposal. That is to fund the going forward with building, anything that goes on with that. Also in this budget, let's see.
Can you repeat that about the new building we have, because I didn't see that in here. What are you saying?
It's the non-operating.
It's non-operating portion of it. You're looking at wrong sheet.
This one
Oh,
here.
okay. So in the non-operating budget is where we, for our new building, we're talking about the funds for that.
Yes, expenses for the new building. The revenue will come from our reserves, from our trust, and the withdraw from them to cover the non-operating expenditures. And then the increase in the expenses are due to the increase in the funding. So that has to do with wages and program expenses and such. And so really that's the gist of the changes. Is there any questions?
Yes. Were you starting to talk, James?
I was just gonna ask about marketing real quick. I was wondering if that included like program brochures and that type of.
Yes.
Okay.
Are we still using our billboards and things? We've been using, are there messages up on all our billboards still yet?
Billboards, like the one on our building? We
No,
don't- we
I
have
believe,
one.
are you talking about, I believe we've got some related to our Narcan distribution and some of
We
our
have
programs.
Anyone Can campaign as well as the EPA-led grant campaign that are currently running right now.
And what are those?
The billboards?
Yeah,
The
no, what are those two
campaigns.
campaigns?
Am I allowed?
Yeah.
Okay. So the Anyone Can campaign is our Narcan awareness. That's in collaboration with the Jefferson County Drug Prevention Coalition, which is under
Perfect.
the health department here. So it's just awareness about the fact that we have Narcan kits available within the health department, as well as like there's 8 other locations throughout the county. So it's really just to kind of encourage folks to get yourself, kind of guarded with Narcan, and, it's available, and learn how to use it. The second one is the No Lead campaign, which is part of our Superfund EPA grant, which encourages folks to, the three main things are get your kiddos tested, get your soil tested, and know the facts. We are considerably in a good part of the lead belt here in Jefferson County, particularly with like the Big River, different things like that. So it's really just to continue keeping that message in front of folks. Billboards is a great way. We have, we try to place those strategically. I've got a lot of the lead campaign ones more towards like the Highway 30 corridor and south, because that's where we tend to see our heavier lead populations, or what we see our elevated levels and such. So we've done other billboards in the past, but those are the two that we currently have running.
Thank you very much.
You're welcome.
Do you know what's in our budget to go towards drug-related programs?
Currently, we do have some restricted funds for drug prevention.
What would it be called?
So that would be underneath. There is a breakdown.
I see something that says overdose data to action 53,000.
Yes, that's also.
Is that
Yeah, that's
also-
also a program. That's a
Like
fund
that came into us as income.
Yes,
spent for
we've
that.
had that for a couple of years now, actually.
So again, looking at things in terms of overdose prevention, helping to build up prevention skills in kiddos, to keep them from starting drugs in the first place, and helping to raise awareness in terms of safe locations for drug drop-off. We also have a syringe drop-off location so that people can safely dispose of their syringes.
Right.
So all of those things would be wrapped up in that type of campaign.
I'm just curious, how many people in this room had friends or people in their circle that died this year from drug-related overdoses / accidents, etc.? I've had 4 teens. 4. So wouldn't everybody,
So,
I mean, it's a serious problem in our county and everywhere across the country. We need to continue to do more. That should be one of our main things that we're working on.
Said there were 3 sources of new money. What was that one to?
So the epidemiology and laboratory capacity, it increased by 355,000, 356,000. The Superfund lead, health education, that increased by about 109,000. And then I did say new child care inspection sanitation. That's not really new. I just, for some reason, I didn't have it in last time's budget. So when I was revamping, I made sure it fit this one. That's 10,000.
Good, thanks.
Kelly, is there anything that we can do as a health department to offer some of the single moms that are struggling somehow, childcare somehow?
Goes to the Department of Social Services.
I know
Correct.
we see their kids for health reasons, but.
So one of the things that we do is through our, and I'm sorry, I didn't mean to interrupt, but one of the things that we do, we've got both a resource navigator, or basically a vulnerable population specialist, who will work with individuals to connect them to resources. So not only maybe childcare subsidies, but as well assistance with housing, assistance with maybe getting on to WIC or food supports. And then as well. And so, yes, and then the Aspen tool that Jackie Brown came in and talked with us a little bit about earlier in the year, actually is doing that as well. Is that they're going to be, the people may come to us for one reason. They may come to us for family planning, to get their annual visit. They may come to us for Narcan, to learn about, how to provide it. And then our goal is to look at that whole person and what are all of the resources that they need to be able to support them. And then the goal is to be able to connect them to all those resources, whether they're internal to us or a lot of our partners through the Jefferson County Health Network. So as you said, Division of Family, our social services, Jefferson County Community Partnership, and Jefferson Franklin Community Action, thank you, are ones that actually do provide some of the support. So we do the warm handoff to make sure that people are getting needs taken care of.
I just want a clarification of why our legal expenses budget would be $182,000.
This projected based on this past year. That's prior to the lawsuit that was up through September.
Correct.
If you divide that by 12, that's $15,000 a month budget for legal services.
Yes.
That's quite steep. I don't see why we would do that.
Because it's based on the projection of what we're currently spending due to the fact that we've had a numerous sunshine requests, numerous
Actually,
pieces of
legal department
information.
don't need to
Ma'am,
do-
I'm sorry, can I finish? But
Yeah,
we
sure.
have had numerous pieces of litigation that have had to be reviewed. Over this past year with COVID, all of our orders we ensure that they are in compliance with the law, as well as there have been legal matters that have been brought to the agency that prior to about June 2020 were not a issue within our county. And we had maintained probably about a $10,000 to $11,000 budget for legal expenses. But since that time period, we have significantly grown in that revenue or that expense line item. And so in order to ensure that we are allocating and ensuring that we are prepared for any potential expenses, Kristen had to forecast that out for what the potential could be, and that was the price.
I know you're saying,
I'm sorry, as a point of order, we should have a motion for it, discuss this any further, should we not? If we're gonna approve it, should we have a motion and a second first, discuss this? I'm just asking.
That's fine. I don't know where this.
Yeah, the discussion just kind of.
I know, in a whip, but I think we should.
Okay, yeah, let's do that.
I'll make a motion, we approve the 2022 budget, $8,640,299.
Seconded.
Now, I'm sorry, I just want to make sure we're following rules.
Yeah.
I don't agree with setting aside in the budget $182,000. You know, hopefully, God help us, we don't use that kind of money legal wise. I believe that the Christie doesn't need to be involved in any of our sunshine requests. I believe that Jennifer Pinkley would receive a request for sunshine, and then she would provide whatever they needed. Why even,
Yeah.
you know,
That's
just provide what they're
that's just
asking
not the
for.
way things work, unfortunately. So,
It'd be nice if we could have an intern do the sunshine request, but that opens us up for a lot of liability when something's done incorrect.
And it is a budget. It's definitely not a checking account. It is a budget.
Right.
So, and I know that most other places, I know that the county, everything goes through legal. All the sunshine questions.
So let's just ask, what was the allowed in the budget last year for legal expenses?
I believe we had about 25,000,
Yeah.
because we doubled it from the year before.
We doubled it from the year before, and again, Ms. Davis, I did question the number when I saw it at first, but after looking through and understanding the rationale behind it, the data that is forecast in terms of if our legal expenses continue at the same rate as they have been, and again, prior to the lawsuit, it would put us at that amount. And as a agency, we need to ensure that we are setting enough aside to ensure that we have adequate funding. And we don't anticipate that our expenses will go down at this point in time. Unfortunately, I wish they would, but at this point in time, we have to work with what our current known is, and that's what our current known is.
I believe if we had a little bit different focus, we wouldn't have this problem with the public always pushing back at us. I believe that we could, you know, if we would just back off of the mitigations, the masks, the quarantines, we wouldn't have this problem.
And I believe if we didn't have board members soliciting people to
Get
put
back to
sunshine
normal.
requests
Get
in,
back to
we
normal.
wouldn't
I'm
have-
gonna say
Call the
again,
motion,
let's get back to normal.
Call the question.
Call the
back
question.
off doing our job. Okay, so we have a motion and second to approve the budget as written. Everybody may have their own opinion, but you can express that in your vote. So all in favor of approving the final 2022 budget, please say aye.
Aye.
Anyone opposed?
Aye.
move forward line.
Thank you, ladies.
Okay, so we're gonna move on to new business. First item is to establish an insurance subcommittee. I know Ms. Davis mentioned something pertaining to this earlier. Our insurance policies for a variety of things are coming due. And so, as we do with a number of other issues, we farm out the actual work to a subcommittee, who then makes recommendations to the board, who then votes on whatever action is needed. So I'd like to establish a subcommittee to look into our insurance policies. Davis, he'd asked or expressed an interest in doing that committee membership at the last meeting, so I'd like to appoint you and Mr. Pig to this subcommittee. Acceptable to you?
I'd rather do it with Amber, but with the chairman.
That's fine. I mean, I don't,
I'm on multiple other
Yeah,
committees right now.
we're trying to spread the committee memberships around. So.
Or even with James.
I'm on several, I can give advice if you guys need it, but I don't find myself down any more than I am.
Whatever you see fit, sir. I will serve.
All right, so we have a motion to establish the insurance subcommittee with Davis and Mr. Pig as members.
So moved. Second. Give it to Amber. She.
okay.
Okay, any other discussion? Who's gonna lead that?
On your side, who's going to lead from your side will be Kristen.
I did have just one bit of discussion. Is that going to cover renewals or is it just going to be an overall dive into existing policies?
I think we have some coming up for renewals, correct?
I don't just know, but
Yeah, I believe we're looking at the renewals at this point in time. So as they're coming up, we would like to just look at what options are out there and have a group.
Yeah, maybe the committee can look at the schedule for upcoming renewals and see if we need to keep it.
who on your side's going to be
That's a good point.
Would that be you or would that be Kristen? See,
So I'm trying to write all this down.
I'm so sorry. Would that be you or would that be Kristen for insurance or Mr. Crawford?
Probably Kristen and I, we both. And then we may pull Crawford in on some of it too.
Okay. Sorry, did you vote?
Not yet.
Okay. All right, here, no other discussions, all in favor of establishing the insurance committee, please say aye.
Aye.
Opposed. So we'll lose item 2 to after closed session. Next item is to act on the choice of a law firm. Do you want to explain?
Sure.
Chrissy?
I submitted my resignation yesterday from Sandburg Phoenix, and I am starting with a new firm tomorrow, Lewis Brisbois. And you have the ability to keep your work with Sandburg Phoenix, to send it to Lewis Brisbois, or to follow me to Lewis Brisbois, or to select a new firm entirely. If you have any questions about that, I can tell you that the rate structure would all stay the same. And that Michael McGinley, who is the attorney that you're working with from Sandburg Phoenix on the building and the new building and the real estate issues, has gone to Lewis Brisbois effective last week. So the options that you have, again, stay with Sandburg Phoenix, to go with me to Lewis Brisbois, or to seek if you're all together.
Okay, so can I have a motion second, then you have discussion?
What's the motion? a motion that we, move with, stay with Christie as the attorney, and move with her to her own firm.
I second.
So that's the option that we're looking at this point. So any discussion on that?
Mr. Chairman.
Yes.
I again feel like we're not being very diligent and prudent with our resources that are given to this department and trying to enter into a lawsuit that we really have no business getting into. Our policies are working just fine the way they are, and we do not need more government overreach in our citizens' lives.
Point of order, this is not
Well,
about,
And I
this is just
believe
the
that
topic of the
Ms.
lawyer.
Sandberg's has encouraged us to go into that lawsuit, and I don't agree with keeping her on as an attorney. I think we should seek other legal advice.
That's your opinion, okay. Any other discussion?
I would just like to remind everybody that we went out and looked for a lawyer last year. Was it last year or a year and a half ago?
Yeah.
A year and a half ago, and we took bids and looked at all the different law firms, and this is the law firm we chose. So that's why I'm recommending that we stay with them.
And
if we're talking about being prudent, I think that, staying with the person who has the experience and has dealt with the issues that we're facing, which now keep getting more and more complex. And rather than finding a person who's going to have to start from square one, I think that's the advisable way to go.
did Ms. Coleman win our lawsuit, the one that was that Mary Coleman, Elizabeth Coleman had against us?
But her case has not been tried yet, Mr. Davis.
I believe, for the record, that the judge ruled in Mary Elizabeth Coleman's favor.
I believe for the
Did
record,
not
Ms.
win
Davis, that the case has not been tried yet. So that is
So
an
I
inaccurate
believe-
statement.
I believe that it did get a lot done that she had asked for it to do, so not saying that, anything else, but I would love to see new representation to bring a new vibe to our meetings.
Sure thing. Okay, hearing no other discussion, so the motion is to retain Christie as our attorney. We have a motion and second. All in favor, please say aye.
Aye.
Any opposed?
I
That passes 4-1. We have the item pressed by board member, and you wanted to delay that, Ms. Davis?
Yes.
Okay. All right, so we're gonna go into closed session, talk
Point of order.
about.
That was not changed in the amendment
On the agenda.
on the agenda.
Well,
When we made the amendment, that was not changed.
we did this.
It was only changed to keep the change of recommendation going to after closed session.
Fine, but we're gonna have discussion on the. On the order, so. Okay, so can I have a motion to go into closed session?
Motion to go in closed session.
Second.
I second pursuant to 610.0211 and 14.
Discussion. All right, so we have a roll call for that, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis,
Yes.